neurodegenerative disease, which is the second most common degenerative disease after the Alzheimer's disease. This disease is called Parkinson's disease or Parkinsonism. This disease was described by James Parkinson in the 18th century, and since then we have learned a lot about this disease, its medical management, and we have good surgical options too. What is Parkinson's disease? Parkinson's disease has three cardinal features. 1. Tremor. 2. Rigidity. 3. Bradykinesia. A tremor would mean a shaking of the hand. Bradykinesia is slowness of movement, and rigidity means that the whole body becomes stiff. If you have these cardinal features, you diagnose the patient to have a Parkinson's disease. But I would also like to mention that it is not essential that every tremor is a Parkinson's tremor. And we have to distinguish the other causes of tremors from the Parkinsonian tremor. The other commonest tremor is called a benign essential tremor, which is usually seen in both hands and is usually goes in families. Once you have diagnosed Parkinson's disease, it is always a clinical diagnosis. One need not necessarily do investigation till the time you suspect the diagnosis of Parkinson's disease. The initial management is management by giving drugs, which would mean that in Parkinson's disease, there is a deficiency of a neurotransmitter, dopamine, which would mean that you replace dopamine from outside to increase the amount of dopamine at the dopamine receptors. In addition to all the drugs we have, it is extremely important that the patient keeps himself physically and mentally active, and in fact, physiotherapy is an integral part and a very important part of the treatment of Parkinson's disease. 75 to 80% of patients respond to the medical treatment. But the unfortunate point is that over the period of time, the Parkinsonian drugs have their own side effects and lose their efficacy. Then these patients need to be evaluated for a procedure called deep brain stimulation, which means we stimulate the deep structures in the brain and improve the symptoms of Parkinson's disease. I must very clearly mention that whether we use drugs or whether we use DBS, we don't cure Parkinson's disease, but we try to improve the symptoms of Parkinson's disease. My advice is diagnose Parkinson's early, start treatment early, and improve the quality of life of your patients.